Important features of vitamin D are discussed in this video. So vitamin D is cholecalciferol that is either converted in the skin from a molecule, or it is absorbed from the dietary sources in the dairy products and fish oil and fortified foods. This vitamin D3 is not an active substance. It is first converted into liver, and then it is converted into the kidney in the and the final product is 125 dihydroxycholecalciferol, that is the active product. So there is a direct effect of this concentration feedback inhibition by the 25 hydroxycholecalciferol of the this cholecalciferol, and this liver product is then in the kidney. It is transformed into 125 dihydrocholecalciferol, and this process is governed by the parathyroid hormone. So this plasma calcium ion concentration is the factor that limits this conversion. So this 125 dihydroxycholecalciferol then causes the increased calcium binding protein production in the intestinal epithelial cell, calcium in stimulated ATPase formation and alkaline phosphatase formation, and all these effects lead to increased intestinal absorption of the calcium. So there are several estrol, there are several compound, and they more or less they have got the same function. And one the dehydrocholesterol, 7-dehydrocholesterol, under the influence of the ultraviolet rays, it is converted into vitamin D3, and sun exposure is important for this process. So exposure uh, prevents the deficiency of this vitamin. So the ingested vitamin D compounds are identical to the cholecalciferol, and so this conversion is not necessary. They are identical to the cholecalciferol that is formed in the skin, and there is some substitution of one or more atoms that do not affect the function. So the cholecalciferol is converted to hydroxy 25 hydroxy cholecalciferol in the liver, and there is feedback inhibition of this process. If this 25 hydroxy cholecalciferol is increased in the blood, then it is going to suppress the conversion. So the liver is the site where the vitamin D is conserved for the future use, and the 25 hydroxy cholecalciferol has got a life of few weeks, while vitamin D, it remains in active form. It remains in for the cholecalciferol. It remains there for many months. So this graph is showing that there is a rapid initial increase. This rapid initial increase in the 25 hydroxycholecalciferol with increased vitamin D3 intake, followed by a plateau once the normal range is achieved. The liver efficiently converts vitamin D3 to hydroxy cholecalciferol, 25 hydroxycholecalciferol at low intake level. However, as the intake increases, the conversion is slow, and plasma 25 hydroxycholecalciferol levels plateaus, staying within a narrow normal range. This is due to feedback inhibition. So conversion of this 25 hydroxycholecalciferol into 125 dihydroxycholecalciferol occurs in the proximal tubules of the kidney, and it is the most active form. 125 dihydroxycholecalciferol is the most active form of the vitamin D because it has got 1000 times potency as compared to 25 hydroxycholecalciferol, and this conversion is hormone dependent because parathyroid hormone exerts a potent influence in determining the functional effects of vitamin D in the body. So there is an inverse relationship between plasma concentration of 125 hydroxycholecalciferol and calcium in the plasma. As this calcium is increased the hydroxy to 125 hydroxycholecalciferol, they becoming decrease in the plasma. So rate of secretion of parathyroid hormone is greatly suppressed when plasma calcium ion concentration rises above 9 to 10 milligram per 100 ml. So normal plasma calcium concentration is 9 to 10 per 100 milligram. When it is decreased, so there is increased parathyroid hormone, and in the kidney, the conversion of 25 hydroxycholecalciferol is increased into 125 hydroxycholecalciferol. When the parathyroid hormone level, when the calcium concentration is increased, this parathyroid hormone level is decreased. So due to decreased parathyroid hormone level, the conversion is less into 125 hydroxy. Instead, this hormone is this product is converted into 24-25 dihydroxycholecalciferol that has got limited vitamin D effect. So there is absence of 125 hydroxycholecalciferol. As a result, the calcium absorption from the gut, bone and kidney, it is decreased. So it helps in maintaining the normal level of the calcium in the plasma. What are the effects of this 125 hydroxycholecalciferol? It causes the calcium absorption and phosphate absorption. So from the gut, bone and kidney, and this will help in the extracellular fluid feedback regulation of these calcium and phosphate. So vitamin D receptors, as it is steroid, these receptors are mainly located in the nuclei of the target cell and present in most cell in the body. They have got these receptors that are present in the nuclei. They have got a hormone binding site and DNA binding domain. So they are more or less like thyroid hormone action. So there is retinoid X receptor and the vitamin D receptor, and these causes the gene transcription and messenger RNA formation. As a result, the proteins are formed. Some of the cases there is a decrease in selected cases where the transcription is decreased. So this 125 dihydrocholecalciferol is about 1000 times potent than 25 hydroxycholecalciferol. So 125 dihydroxycholecalciferol takes to exert 2 days to exert its effect, and it causes the increased production of cal binding that cause the facilitation of the or increase permeability for the calcium into the cell, and these cal binding then facilitate the diffusion of these calcium into the body. So this effect remains for several weeks, and this effect is prolonged even after removal of this cholecalciferol. This effect remains for several weeks over there. There is also formation of calcium stimulated ATPase and alkaline phosphatase. This calcium also indirectly causes the absorption of the phosphate, and directly 125 dihydroxycholecalciferol also exert this effect. There is a phosphate absorption that is increased. It also causes decreased calcium and phosphate excretion through the kidney. In the bone metabolism, the vitamin D has got dual effect. It also causes the bone resorption and also causes the bone deposition. When high doses are given of this 125 dihydroxycholecalciferol, there is bone resorption. If in the absence of this vitamin D or dihydroxycholecalciferol, the parathyroid effect of the bone resorption is blunted or almost it is failed. This is possibly due to calcium transport that is increased through the cellular membrane. In physiological limits, the vitamin D or 125 hydroxycholecalciferol, it causes bone deposition because there is increased calcium and phosphate absorption, and there is also mineralization increased. And this is due to increased calcium transport to the cellular membrane of the osteoblast. Thank you for watching this video. If you have any query, please write in the comment box.